listen-only mode until the question and answer session. At that time, credentialed members of media can press star 1 to ask a question and star 2 to withdraw a question. Today's call is being recorded. If you have any objections, you may disconnect at this time. I would now like to introduce Mr. Benjamin Haynes. Thank you. You may begin.
Thank you, Courtney, and thank you all for joining us today. We're joined by Dr. Satish Pillai, who is leading CDC's Ebola response, who will provide an update on Ebola. And we'll also be joined by Dr. David Fitter, CDC's lead for the Hantavirus outbreak, who will also give an update before we take your questions. I'd now like to turn the call over to Dr. Pillai.
Thanks, Ben, and thank you all for joining us again. As I've mentioned before, this is a complex and fast-moving situation, and I want to assure you that CDC and our federal partners are working around the clock to ensure our information is accurate and that action plans are being implemented immediately. Yesterday, we reported a confirmed case of Ebola in an American who was exposed while working in DRC. I'm glad to report today that that individual is currently in transit to Germany for care. And I want to publicly thank our German colleagues as well as the ministers of health in DRC and Uganda for their vital partnership in facilitating these transfers. In addition, the other 6 individuals who are identified as high-risk contacts are also having movement plans that are finalizing and will be transiting to Europe as well shortly. An additional point that I'd like to make is genetic fingerprinting from this outbreak shows that it is similar to the genetic fingerprints from the 2007 and 2012 outbreaks. This means that our diagnostics we have available work to detect this strain of Ebola virus. As this fluid situation evolves, we are continuously gathering information and will aggressively adjust our response as needed. Let me walk you through exactly what the CDC is doing right now, both here in the United States and on the ground in DRC and Uganda. In the United States, the CDC has immediately issued an order to suspend entry of certain persons from DRC, Uganda, and South Sudan due to Ebola outbreak who have been in those countries within the past 21 days. We've issued 2 travel health notices, including elevating the DRC notice to a level 3, recommending against all non-essential travel to the Ituri and North Kivu provinces. We just released a health alert network, and we've engaged our public health and clinical partners nationwide to ensure frontline providers have the information they need to protect Americans and provide care. To support our domestic healthcare system, CDC is providing extensive clinical guidance, training, and strict infection prevention control protocols for hospitals evaluating suspect cases. And we're coordinating directly with state, local, tribal, and territorial health departments to ensure immediate patient isolation, specimen collection, and testing if Ebola is suspected. And finally, leveraging our long-standing 24-hour, 7 days a week laboratory response network, we are ensuring rapid vital testing is available directly at the CDC or through a distributed network of public health laboratories nationwide. Globally, CDC is actively deploying resources. Through our country offices in DRC and Uganda, we are providing direct technical assistance for aggressive disease tracking and contact tracing, rapid laboratory sample collection and viral sequencing, strict infection prevention and control efforts, local border screening operations, the provision of personal protective equipment and critical infection control supplies, risk communication and community engagement in the hardest hit areas. And I close by noting that the risk to the United States remains low because of the actions noted above. However, travelers to these particular areas must avoid contact with sick individuals, report any symptoms immediately, and strictly follow our travel guidance. Our highest priority is the health of those affected and the health security of Americans, both at home and abroad. Thank you, and I'll turn the call over to Dr. Fitter.
Hi, good afternoon, everybody, and a huge thanks to Dr. Pillai. I want to provide a brief update on our ongoing response to the Hantavirus outbreak linked to the MV Hondius cruise ship. Let me start by saying there are no hantavirus cases among the returned U.S. passengers, and the risk to the U.S. is low. CDC continues to work closely with state and local public health departments to ensure health monitoring of all U.S. residents linked to this outbreak. Our priority, as always, remains the health and safety of all Americans, both the passengers who have returned and also our communities. Thank you very much.
Thank you, Dr. Pillai and Dr. Fitter. Courtney, we are ready to take questions.
Thank you. If you are a credentialed member of the media and you would like to ask a question during the call, please press star 1. You can press star 2 to withdraw your question. You may queue up at any time. Our first question comes from Leanne Winnick from CBS News.
Hi, thank you. I have one question on Ebola and one on hantavirus. Is the U.S. ramping up our Bugyo Ebola PCR diagnostic ability in the U.S. in anticipation of travelers coming from the World Cup, or doing anything else to screen those travelers expected in about a month? And on hantavirus, could you give some more details on the end date for quarantining in Nebraska? We understand at least one patient would like to leave now. What advice and what measures are being taken there? Thank you.
Thank you for the question, and you'll see in the Health Alert Network that we are releasing today the information about public health capacity. There is capacity for detection of the Bundibugyo strain of Ebola virus in the Laboratory Response Network, as well as at CDC. And David?
Yes, thank you. With regards to those that are in Nebraska, a decision was made across the union leadership in the U.S. government to have the passenger stay in Nebraska until May 31st, which marks the 21st day of their monitoring period.
Next question, please.
Our next question comes from Amy Maxman from KFF Health News.
Hi, thanks a lot for this briefing. I'm wondering what groups, I know that U.S. officials at USAID and CDC can't be on the ground in Ituri or North Kivu due to security concerns in terms of actually working in ETUs and doing work on the ground. So I'm wondering what groups you're working through who will do that work that you're supporting.
So the U.S. government, CDC inclusive, has multiple implementing partners that help with our epidemiology work, which is contact tracing, alert notifications, data monitoring, as well as laboratory partners, border health specialists. These are partners that are groups that we've worked with in DRC and in Uganda for a long period of time. Similarly, for the non-governmental organizations, our partners throughout CDC and the interagency continue to dialogue and ensure that we're sharing information about what we know and determining what needs they may have to better understand the outbreak and ensure the health and well-being of their staff.
Could you please name the groups?
Yeah, we can follow up. There's an extensive list of groups.
Next question,
thank
please.
you. I appreciate that.
Our next question comes from Sophia Basoli from NBC5 Dallas-Fort Worth.
Hi, good afternoon. Thank you so much for doing this. I was curious in regards to the World Cup and the team from the Congo, and since they will be playing in Houston, what are the process and I guess the monitoring steps that are taking place for the team and the personnel as they get ready to make their way here for the World Cup?
Thank you very much for the question. We're actively working with FIFA to ensure that there is safe traveling, safe passage, and ensuring that travelers and the American public remain safe throughout.
Next question, please, Courtney.
Our next question comes from Yuri Benajold from ABC News.
Hi, guys. Thank you for taking this call. On the American doctor that was sent to Germany, are there any plans for further travel to the United States for him to get treatment here at home, or is there a plan to just have him continue to get treatment in Germany?
At present, the key issue here is ensuring the treatment is initiated rapidly and appropriately, and the initial location being Germany, given the proximity and the access to the highest levels of care.
And just to quickly follow up, if I could, are the remaining 6 passengers also going to be quarantining in Germany, and if so, how long?
The individuals are traveling to Europe, and including in Germany, and they will be in quarantine during their monitoring period.
Next question, please, Courtney.
Our next question comes from Mike Ehrman from Reuters.
Hi, thanks. Just wondering if you can quantify how many people CDC has deployed overseas for Ebola, and also how many people in the U.S. are working on this, and also what is State Department's role in the response?
I'd like to take a step back here and just remind everyone that CDC has, as well as the U.S. government, have been supporting DRC and Uganda for decades. We have responded to viral hemorrhagic fevers repeatedly with our ministry partners, interagency partners, and international partners. We have a long-standing presence with a large country office in Uganda with nearly 100 staff, and in DRC with nearly 30 staff members. So there is a team of individuals that have been long-standing presences in these countries and have long-standing partnerships. In addition to that, at headquarters, we have dozens, actually probably hundreds of people at this point that have been onboarded into our emergency response, which stood up officially 2 days ago. And we have staff that are continuing to ramp up and deploy to the affected countries. In fact, we have an individual that will be wheels up tomorrow morning to go to DRC, and we will continue to operate using the playbook that we have used time and time again to coordinate and respond appropriately.
Next question, please.
Our next question comes from Deidre McPhillips from CNN.
Hi, thanks so much for doing this. 2 questions about travel into the U.S. I'm wondering why there are restrictions on non-U.S. passport holders, but for people with U.S. passports, are there any restrictions from them coming into the U.S. from places that have been affected by Ebola? And also, we're hearing that screening is happening at certain U.S. airports. Can you expand a little bit on that? Which airports are doing screening, and how is this being done? Thank you.
So I want to go back to the fact that we are using the tools that we have currently to respond effectively based on the information that we have presently. This is an evolving situation, and we have taken a conservative approach initially as we learn more about an outbreak in a highly volatile part of the world. And this will be continued to be revisited. And in terms of the operationalization, we will continue to work with our partners and our state and local partners to discuss how the next steps will unfold.
Next question, please.
Our next question comes from Erica Edwards from NBC News.
Hey, thanks so much for doing this. I wanted to follow up on the question about staffing in Uganda and DRC. Can I confirm that the nearly 100 staff in Uganda and the nearly 30 in DRC, those are both U.S. assignees and local employees? And then did I hear correctly that you have one person going tomorrow? Do you anticipate sending more people? And then I have a question about Hantavirus, but wanted to start there, please.
Yeah, our U.S. direct hires and LE staff, it is inclusive of both groups. We consider our staff our staff. We have one person that has their travel papers and are leaving, but that is the first of many additional people.
Okay, thank you. And for Hantavirus, if I could, I wanted to ask about the passengers in quarantine. You had indicated last week that you'd encourage the passengers to stay in quarantine in Nebraska. Stop short of saying that you'd keep them there. Local health officials have said people would have the option of quarantining at home. And I'm just curious, why did that decision change? Why can't those two passengers leave? Thank you.
Certainly. With regards to the Nebraska quarantine unit and those that are there, we're constantly regarding the situation and evaluating where things are. And as I said a little bit earlier, a decision was made across leadership in the United States government to have passengers stay in Nebraska until May 31st. We are continuing to coordinate very closely with all states that are impacted by this, that their residents are impacted by this.
Courtney, we have time for two more questions.
Our next question comes from J.C. Fortin from the New York Times.
Thank you. I want to make sure that I'm clear on the answer to Yuri's question about where the Americans went. You said that 6 Americans who were exposed to Ebola went to Europe. Is it right that they went to different countries, including Germany? And a second question on Hantavirus, which is that before we learned that the total number of people being both quarantined and under monitoring in their home states was 41. Is that number still correct, or have there been more exposures since, more people under monitoring? Thank you.
We have 7 individuals that will be in Germany. We are working with an additional host country for the seventh individual, and that is the Czech Republic.
With regard to some of the monitoring, with regards to high-risk monitoring, it has actually gone down. This goes to when we initially started the monitoring, we had the information available to us. CDC has been working extraordinarily hard with regards to our epidemiologic investigations to get further information, and we were able to reclassify and we decreased the number of high-risk contact exposures.
Over. And our last question, please.
Our last question comes from Giselle Grayson from NPR.
Hi there. Can you tell me a little bit more about the supply chain? You mentioned you're sending all kinds of equipment, tracking, PPE, et cetera. Can you say what you've sent, when you expect equipment to get there, and where is it going?
This is an inclusive list of what the requests are through our implementing partners. So laboratory supplies, implementing partners can use the resources that we've provided to ensure that the health department, the ministries of health, have the resources they need to respond effectively.
So you mean these are the requests that are coming in and nothing has gone out yet, or what stage is it in?
So keep in mind, the CDC isn't shipping supplies. There are systems in place for implementing partners to procure and identify the resources that are being requested to appropriately respond to the needs of the ministry.
Thank you, Dr. Pillai and Dr. Fitter, and thank you all for joining us today. A transcript and audio file will be posted to the CDC media site later today, and this will conclude our call.
That concludes today's conference. Thank you.